Why is it, wait, okay. Oh, okay. Where's, oh,
Hi.
hi, Colby. Okay, can you hear me?
I can hear you.
Okay, how are you?
I'm wonderful. How are you?
I'm wonderful too. I am really good. Thank you so much. Okay, all right. So we're all good. I have all your stuff. All right, let me put it on record. Okay, recording. Okay, all right. Good afternoon, everybody. Welcome.
Sorry,
Oh,
I didn't look at the
all
screen.
right, hold on.
Hold
Wait,
on.
um,
How are you?
I'm good. Hold on. Wait, make sure. Is it pause or record? Okay, good. All right. All right. Good afternoon, everyone. Welcome to Raising Strong-Willed Kids live conference. And it's Parenting with Ease, Confidence, and Connection. My name's Andrea Milioti, and I'm your host. And today's guest, Kolby Kail. A little bit about Kolby. She's the owner and head speech language pathologist at Kolby Kail Speech Therapy in San Diego, California. For over 17 years, she has been helping families thrive through improving communication skills. She is a certified speech language pathologist, certified was that orofacial
Myologist.
myologist and parenting coach. She guides families to help with speech and language deficits, behaviors, potty training, feeding, routines, and much, much more. So, without further ado, welcome, Kolby, and thank you for being here.
Thank you for having me.
You're welcome. I'm going to ask the first question. That what I couldn't pronounce. If anybody else doesn't know, I would love to know what is that?
An oral facial myologist is someone who works on rest position of the mouth. So when we are at rest, the tongue should be at the top of the mouth here and
Right.
not the bottom of the mouth. And so sometimes you see children and even older adults that when they rest their tongue between their teeth, we start
Right.
an opening, which is called an overbite, or you can get an open bite where the teeth start to come out forward in terms of they tip.
Yes, really? Okay.
Or they can tip back. So usually we do a series of exercises so we can get all the parts of the mouth where they need to be, because you get orthodontic relapse and all these things. So usually you
Right.
start with very crowded lower teeth and you don't have this nice round here. And this
Right.
your tongue creates this round here. And if your tongue isn't sitting high in the mouth, you usually get a very narrow mouth and then a very
Yeah.
high palate. And so that's hard for the tongue to be housed in. And so
Right.
while we're on that note, if your child does do mouth breathing, and especially at night while they're sleeping, you're going to get lots of ADHD symptoms. We're finding that oral rest position during sleep is one of the biggest causes of ADHD, and it might even be a sleep disorder manifesting in all of those types of activities. So if you have
Really?
a child that drools, that grinds their teeth, that open mouth sleeps, and so they snore, you really need to get your child seen by an oral facial myologist so we can give you some pointers on how you can get your mouth to stay closed when not talking, and especially when sleeping, because your nose does a lot to the air as it's going into your lungs, and then after it leaves your lungs, it feeds your brain, all of your organs inside. And if you're breathing through your mouth, your brain and all of your organs are not getting the proper amount of oxygen. And so that is why we have so many behaviors during the day. So sleep is very important, as we all know, but proper sleep is also a huge part of that. So we just want to kids are breathing through their nose all day long.
That's why, like, when people sometimes they're sleeping and they sleep with their mouth open.
Yeah, they sleep with their mouth open. So they have an
Yeah. So
open.
that's all.
Yeah.
Yeah,
And it's
because I know some adults do that too.
oh yeah, I see lots of adults. So in terms of the oral
That's
facial
really
part of it, yeah,
interesting, and how that's affiliated with the ADHD and everything. That's amazing.
yeah.
I never knew that. That's really interesting.
The Washington Post has done a great. If you just look up sleeping and ADHD and breathing, you can find a great article from Washington Post. I think it's almost a year old now, but we are finding that there is a correlation between sleep and breathing, and then behaviors during the day. So, kind of lead
Awesome. Interesting. I like that. I just learned something. I like that. I really awesome. That's really great. Thank you. Thank you for sharing that. Okay. And okay, so basically the topic that we're discussing is child communicating. Like what is your child communicating? And so so you talk about behaviors communication. What does that mean exactly? Like behavior, like communication.
Well, behavior is communication. So
Okay.
when babies are born, they communicate through crying, and there's different cries, as most of us with children know. And so we know how to address those things. Is it a wet diaper? And then we also go through a process of elimination as parents, because again, we don't know consistently when that is, especially when it's the first baby in the first, couple months. Um,
Exactly.
learn what
Exactly.
that behavior means. And so as your children grow, I was having this conversation with a parent this morning. If your child is usually under the age of 3, 4, they are usually very self-absorbed in terms of they don't quite understand that there are other people have feelings the way that you and I have feelings. So they don't
Right.
understand that their behavior is affecting us. And we have to remember that as parents, not to get angry. I mean, obviously we all, get frustrated as parents.
Mhm. Mhm.
I don't want to scold and get a child in trouble at that age for being quote unquote malicious, if you will, because they're not trying to be mean to you. They're trying to get their wants and needs met, just as a baby continues to cry, even though, and you're just doing the best you can to get through those moments. Being a parent of a young child is difficult. So just try to find your even keel, just the first part. So communications. And then also, what is that communication or that behavior communicating? We try to look at
Right.
the perspective of that kiddo to see where is where is it the breakdown is happening. Do they not know what to say back to you? Do they not know what to do in the moment in terms of the how, what you want them to complete? There's so many things that it could be. Is it attention? It absolutely could be attention, the behavior that they're giving you. So there are lots of ways that we look in terms of the perspective. And many times I feel, at least with my own children, that they don't understand the importance of the activity the same way that I understand the importance of the activity. Also, they don't have the want for a clean bedroom the same way I have a want for a clean bedroom. So it's not on the importance level. And we expect our children to have the same, I don't know, moral
The
value.
same, like because we feel that that's important, that they need to. They
Exactly.
would feel the same way. Like, oh yes, we need like we have the importance for them to keep their room tidy and make their beds and do that. That they should because we feel that way. That they should have that too.
Exactly.
But it's not the case. Yes.
Not the case at all. So even like I get a lot of questions about morning activities, and kids get, after they start getting dressed and stuff, many kids want
Right.
to go back and start doing Legos or playing a game. And then
Mhm.
we wonder why they're not hurrying up. They don't have
Right.
the importance of getting to school on time or
Right.
having to be at work on time that we do. So going down and letting them know, you know what, I can see you're getting ready to put on a couple blue pieces. We're going to save that for after school. We're going to leave it all right here. I'm not going to clean it up. I can see how important this is to you. And when you get home, I'll help you put on those last pieces. So we need to go, and then we'll leave these pieces for right here when we get home. So again, their life matters, their plan matters, and they are heard. And it's not just do what I say and do it now,
Exactly.
which can be hard.
Which it can be very hard because a lot of that's the whole problem. A lot of parents think it's got to be like it's hard. You have to kind of put you want to make them feel that their needs matter just as much as what you're asking of them, that they're just as important. So it's almost like you want to show them compromise, and you want to And
Yeah.
it's about, like I always say, connecting. Like I believe in like connecting with your child and just understanding them where they're coming from as well.
Yeah.
So like that's like a perfect example. This way they know that, well, listen, hey, listen, then I come home and they'll be like, oh, my stuff is right there as it was. And you know, and then they can continue where they did what you wanted them, but you took care of and left what was important to them at the same time. I think that's great. I like, you know, a lot of parents, it is a hard, that's something really, really hard to work on. And it can be done, but it takes a lot of, you know, a lot of practice. Definitely. What do you know if it's developmental behavior? Like how no, how do you know if it's developmental behavior or something more? How could you tell the difference?
Well, in those cases, I mean, if we're having such a like what we talked about earlier, kids that are usually are age 3, and we're getting to the top of age 3 through even 3, 12, 3, 11 before they turn
Right,
4. Um, you need to remember that those kids, like I said, the world revolves around them. When we have different stages of, like, if you will, moral development, in terms of them understanding what is responsibility and how much can you ask of a 3-year-old compared to a 9-year-old. The amount they're at different stages of development, and what do we
right.
do with those stages. So if you actually have questions about developmental stages, I completely reach out and get help, because it sometimes it's a situational thing. So many times I want to get parents on the phone and have a conversation, because there are many factors that go into a behavior that your child is having, especially if they are a strong-willed child. And if
Mhm.
there is something else going on in terms of an internal, my daughter has very bad anxiety and would run out of schools and those types of things. And so
I
it took
relate to that.
it really took me living through that to kind of understand that there was something else than just having the anxiety. Where was the foundation of that? And trying to talk her through it didn't always work. I had
Mhm.
to be in her shoes to find out where is this coming from. And so that would be, it was, I mean, we saw a psychologist and we went to counselors and we went to all of these people, and it took a minute for me to kind of dig through that to find where was the real problem. And so I would ask parents, I mean, I do free 30-minute sessions. You reach out to someone that has a developmental background so you can find out, okay, so in this situation, this is what seems to happen. And my child breaks down like this often, and these are the behaviors in which I'm seeing. So we can find out, is number one, is the behavior normal in terms of age appropriate? Is it developmental? And what can we do as parents, you do as a parent in that moment to move the needle forward? Because that's the whole point of parenting. We want to make sure that we're moving our kids' needle in the right direction.
Mhm.
And usually with kids that are strong-willed, since that's kind of what we're talking about overall, they yelling at them is never going to get you where you want to, even though in the moment sometimes it gets you over. um, I think you have to have a better plan and a better way to move forward, so you know exactly what your end goal is, other than just having your kid follow directions.
Good point.
There
Very
must
good
be
point.
an internal want, if you will.
Yeah, very good point. Like I know that I went through. My daughter has very bad anxiety. She's 24 now, and I went. Oh, she's very strong-willed, and she has extreme anxiety. And to just you can't just talk it through. You can't, and you can't. And it's just like so, and it's like when she. I mean, but at the same time, she's so smart. I mean, at 18 months, she was like speaking full sentences.
Oh,
Like,
wonderful.
yeah, amazing. And you know, my youngest, who is 20 now, when he was 3, I actually had him in speech. He went to early intervention, which you know, like, well, he was 3 years old because he was like, I thought he was speech delayed. He wasn't talking like she was. But when it came down to it, he had an older sister that would never, and then when they would point that out to me, I said, Ashley, like he'd be going like trying to point like he wanted a cookie. You go, no, mommy, he wants a cookie. I say, Ashley, let him say it. Like she would speak for him.
Yeah.
And I'm sure you've heard things like that before.
Oh, for sure.
Have you, right?
All the time. All
Yeah.
the time. Yeah. Was
Exactly. Yeah. And that, is the whole thing. And they're 4 years apart. So it was like, that motherly thing, you know. So yeah, which is not good on the younger one at all, who also has ADHD. So, but no, that's really good. What made parents communicating with wait, what made parents communicating with their behavior? Like, what would make them, like, how can parents, like, help in that communicating factor? I would think that would be
number one, I think
like,
your behavior communicates so much.
like,
So, in my opinion, when we talk about what parents are doing,
yeah, like it,
are also communicating something behaviorally in terms of what they're showing. So,
right,
I had a client who came to me, number one, for routines and how to get a better morning and afternoon routine after school, because there was
right,
so much chaos in their home, and the child was throwing food and was throwing items, was hitting and kicking. And then when we started to dig deeper, when parents got upset with one another, they did the same behaviors. Maybe they didn't throw stuff in the same idea of just throwing things against the wall, but there were things like, you slam things down and you're angry, and that
exactly,
your behavior of this is how you handle frustration. This is how you handle anger. This is how you handle an uncomfortable situation. And so we really had to go into them, and it's really the work about us. Our children's behavior many times mimics what we do and the levels in which we take it. So I got it from Joel Osteen, so it's not mine, but to be the thermostat and not the thermometer, to where you stay even keeled and your kid doesn't, when your kid hits a 90-degree, pissed off, yelling, screaming, tantrum, whatever that looks like for your kid, you're still at a cool 72, and you just wait. Sometimes I have to wait it through. I have many children that on my caseload that have ODD, oppositional defiant disorder, and
mm-hmm.
you set the bar by waiting patiently, and you just, when they fall apart and they have a minute where you really can't have a talk with them about it, you just consistently say, I'm going to be here waiting when you're ready, and
Exactly.
here we go. And so our behavior really does set the moment. And then one more small story, I have another little one with ODD, and mom is she's showing me their homeschool form that shows the day. And this little girl's, at the end of 3, so still in the very much me department. But this little
Right.
cries and screams often. If she doesn't want to do something, that's what we do: is we cry, scream, and use potty language. And so
Mm-hmm.
mom is holding up and showing me their daily routine, and the little girl went to touch it and grab it. Mom, I mean, freaked out. Oh my God, do you know how hard she's worked on that? And like freaked out. And so
That's
the
what.
daughter's eyes were like, "Ding." And when mom is reacting that way to a piece of paper that can be reproduced, I
Mm-hmm.
understand that we all put lots of love and detail in our work, but when we know that our child already is having behavior problems, really taking an inward look at how you're going to behave in the house is going to change so much, because the calmness that you can show is going to really, because in my opinion, when I hear strong-willed child, I
Mm-hmm.
feel behavior. That's all. To me, you're getting a child with behaviors because
Mm-hmm.
they don't want to do whatever it is you need them to do. So remember that in your own day is all I can say. Remember,
Exactly.
how are you going to conduct yourself all day long? Because we all have trials and tribulations all day long, especially as with parents of children that are difficult and strong-willed.
Definitely. I mean, that's an amazing point, because I think that it just shows, because how we react, our kids pick up on how we act. It's like that monkey see, monkey do, but it's because they don't. It's what they see. Like, they'll hear if you're yelling at them and you want them to behave, and you've got to calm down, and then you're reacting. It'll be like, wait a minute, what, you're reacting, so it must be okay,
Mhm.
like, because it's how you react in order for them to want them to be calm. You have to and and again, that's difficult because our first instinct is to react in that way, like you said, with the mother just scream. Yeah, that is the first instinct, and most mothers do that first. But the important thing is to know us, like inside, and to be calm. So that will kind of reflect more on the child, which definitely, right,
Yeah, I think just knowing how you lead your household and what you're in terms of being the leader, think of any
right.
company, how are you putting your best forward, and usually the highest in the company is the one with the one that's setting the tone for the company. And so
Right.
your house, not to say that is it's a business, but I can tell you right now, having a husband and a household and laundry and work and school and afterwards, it's a business. I have to keep all my ducks in a row or we go under, and
Mm-hmm.
so I have to remember that I run this business as much as I would love that my husband took over sometimes.
Yeah, no.
As a wife, I do know that I run the business, and now that I have, and so I conduct my a way in which even I want my spouse to treat me the way I'm treating him. And so if I'm all day long being a not
It
so
shouldn't. Like,
person,
you like to, and you're not being like, yeah, you don't want, then he's gonna be, so you wanna, so the way you go out and treat him and everything, that's the respect and the way he's gonna treat you.
I think
It's
some,
the way that, it's the same way with the kids, you know?
yeah,
I mean, I
well,
know I've been there. It's like, you don't, it's whatever we put out, the
yeah.
way we want to put out the way we want it back again. The same way. And that kind of yeah, that definitely awesome. Again, that's great. That's really great advice. We have time. I think we have another question. We have time for another question. Well, let's see. Okay, why are routines so important for shaping behavior? Having good routines, like how,
Sure.
and being
Sure. Um, be routines, number one, are going to be I mean, don't get me wrong, you can always fall back on a routine, and
mm,
that will always shape a behavior. So if your kid knows what needs to be done in the morning and it is physically up on a wall. And so when my kids were little, I personally used a whiteboard and would write it. Kids have a love fantasy on whatever, I don't know the word I'm looking for, but
oh,
when to erase these things right here, to erase the lines, it is like the best thing a kid has ever done. They love erasing whiteboards. And so
really?
as the kid, my children would go through their morning, old enough. Again, I didn't do this when they were 3, but we didn't go to school really when we were 3. So as they got older, I would be able to do, okay, did you brush your teeth? Zip. Did you pack your backpack? Zip. And don't get me wrong, I didn't leave all of it for them to do. However, teaching them the structure and the way in which the morning goes, these are all metacognitive strategies where we start with the small and it leads to the gestalt, if you will, the larger picture of this is what it looks like to get through the morning good. You have all your stuff ready to go. You've eaten breakfast, your sunscreen is on, your face, your teeth are cleaned. These are the small steps you take to get to this. And it is in everything. If I would like my report to be good in high school, I'm going to need to take this steps to get to a great report. So teaching your kids in the beginning how that goes is going to be, number one, easier on you in the long run, and you're teaching them such a great skill. And so on the other end, when I talk to parents of high schoolers, a lot of the questions, what's for dinner, where's my laundry, all these things that really could be done, you get a some kind of calendar or whatever that works for you. Let your kids help you with what is going to be for dinner and write it on there. So when you say what's for dinner, go check. It's right on it's on the calendar in the house. I mean, in the kitchen. I have calendars everywhere, but uh,
Yeah, I know.
so I just really a routine or some way that there is, another way for the kids to find out what to do other than coming to ask you is the name of the game. This is about independence and teaching your children to be wonderful people in the community and wonderful parents as they grow. And the more we can teach them independence of how to take small steps to get to a good ending, not perfect, but you did all the work, you did all the research, all the things that you need to do to get there. That's really our job.
Awesome. Yeah. It's yeah, basically plain and simple is setting them up for success.
Yeah,
You're
exactly.
teaching them now what's going to set them up as they go into middle school, as they go to high school, as they go to college, when they're on their own because they can't have a hand holder and they need so they get it's setting those little steps up so they
My,
can see.
my grandfather used to say that when graduating high school and having a graduate or graduating or finishing anything isn't constantly about that you finished. It shows people that you can meet a date and do what is asked of you and complete things on time, which shows that you're a good employee, which shows that you can be a trusted person. When you can go through all the things that you have been asked to do, people trust you. And so that's kind of what I want people to understand. Live by your word, and your kids kind of will follow, even if you have to say, this is not a behavior that I'm okay with, and you know, I'm going to wait until you act that way before I go forward in handing you more independence and more opportunities, more skate park visits, whatever your kid wants. They really have to come up to the bar and hold that bar gently. I'm not saying you have to yell at them about it. Just remind them, I know we're going to get to tips here in a minute, but I know that you wanted to go to the skate park today, but your behavior this morning, how was that? Not so good. I'm going to wait until you have a better morning before I want to do something in the afternoon, because that was really tough on me this morning. I had that morning this morning. So, I mean, I get that. Go on. Sorry, I'm jumping ahead.
No, you're fine, but that's awesome. I mean, that's great. I mean, I would never. That's really good advice because it's hard. People just need to. It's holding them to almost like holding them to an accountability
Mhm,
sort of thing.
sure.
And and just no, that's great. Okay, yeah, no, because we're actually good. So, what would you tell people, like some strategies or some tips that could help them, like that they can access right away, to help put a plan into place?
Uh, I have two that are basic.
Okay.
But I mean, if we have more. If you need more, let me know. So the one is, and we do yeses in this family. So my kids, even this morning, when it's time to please come eat your breakfast, I get ignored. I get, I'm doing something right now. All of those types of things, and I gently say, I feel like you're giving me a no by ignoring me. And if you're going to give me no's, I will be giving you no's when you ask me to go somewhere this afternoon. And it's just as gentle as that. Now, I do go a step farther when I've asked a few times that next time I ask, there will be consequences. And then your consequence today will be no skate park after school. And you're going to write me some sentences about what you should be doing. And you hold your line. So after school, when they get home, because you probably don't have time in the morning to write sentences, you have to implement what you said was going to happen, because again, consistency will get you. You never have to be extreme, you have to be consistent.
You have to
You
be
never have
consistent.
to be extreme.
Hmm.
So as long as you put in place what you say you're going to do, your kids will know that when you say no skate park, you mean it. Or
Exactly.
no mall, or no what a mall. Can we go to malls anymore? Um,
Yeah, I
whatever
know.
kid
What's a
does.
mall?
Yeah. So that's all.
What's
I
a
just
mall?
yeah. And then the other one for usually this is, I would say, younger kids, but I'm guessing, in high school and younger. Um, I love you too much to allow you to do that. I allow you too much for my little ones to let you talk like this and use a potty mouth with your friends. We're gonna go home now because I love you too much to allow you to use that mouth around these people. And or even I love you too much to go to a party where I think there's going to be alcohol. And at your age, I'm sorry,
Mhm.
sweetheart, I don't find that it's okay with you, and I love you too much. I'm still your mother. And so you are allowed to put things forward because you love
Exactly.
your kids, even though you're holding a line and they're not going to be happy with you.
Exactly. That's a great, that's awesome. That's great. Anything else? Anything else you wanted to share or how,
No, so that's pretty much. I mean, if you, I have lots of little tips if we
you
wanted
know,
to all day of tips,
I
but
know we can just go all on.
I, I
Definitely, but that's awesome. Now, how could people, I mean, they can email you. How could they find you? How could they,
You can go to my website. It's Kolby, kailspeechtherapy.com.
mm,
And I think we're giving a free gift of coming to the next workshop. So come on to the next workshop. The last workshop was on behavior. So we're going to be right
that's
in line.
great.
We'll be continuing that because it was, a hit and everyone has behavior, especially in these fun stay at home all the time times.
A
And
lot
so
of people
we're
need that.
continuing talking about ways in which you can shift behavior, even if it's shifting your own being. But we have to come up with strips and strategies without losing our minds as parents. And so that's really what I'm trying to do in these workshops is how can we uh, hold our own and still keep our integrity because I know for me, I've lost it a few times and then I have to go apologize to my kids because it's not okay for me to act like that. It really isn't. I'm not a child and I can control my emotions a bit better than that. And, it was hard. It's
Mm,
really, I got a text from one of my best friends last night. The walls are caving in. And, we are, the walls are caving in on many of us, so please come and, it's a free workshop. So anything is, I love questions. We do at the end, we do hot seats. So if you
that
have,
would be great. I mean, I'm sure like a lot of people could really use that because it would be great, great information, great help, especially today. I mean, the walls are caving in for a lot of people today.
mm,
Because everybody is so different and people are at home now, more people working home or they're not working home and they have kids home and it's just with the virtual learning. So a lot of it is really that's awesome. Thank you, Colby.
yeah,
Really, really great and good information and
I
thank
appreciate it.
you for being
Thanks.
on here and I appreciate it. Thank you.
Have a great
And
day.
and you have a wonderful day and I'll talk to you. Have a good one. Take care.